Cozy, cozy.
I guess. Straws suck, or they don't suck.
Yes.
Straws suck, or they don't suck.
Okay. Oh, Precy's on. Hi, Precy. We'll just give everybody else another couple of seconds here to get on. Move the cam. What do you mean, Precy?
Okay.
Hi, Rosie. There's that better, Precy? Yes, okay, good. Anything to suit you, my dear. Okay, these straws do suck.
Yeah, I know. They're not wide enough because the strawberry stuff gets stuck in them.
Okay, so we've got Precy's here, Rosie's here. We're here. And is volume okay? Picture okay? Check on that just before we get started here and see who else will be joining us. You got yours tuned in now?
August 4th live.
Yeah.
I'm getting a commercial.
Oh, right off the bat? No, okay. Rosie says sound and picture are good. Okay. Well, not sure where everybody else is, but I'm sure they'll join us in a bit. This is a long weekend here in our province, but as you know, for us, every weekend's long. Yeah, this is going to be a fight drinking these.
Mm-hmm.
These are fresh strawberry daiquiris. We believe in getting our full serving of fruit every day. Didn't say anything in the Canada Guide about adding alcohol to it.
You got a little lousy straws.
Well, I'm sorry, I bought the cheap ones. Well, soon you won't be able to get straws. They're banning them everywhere.
Yeah, well.
So then you're screwed. Then what are you going to do? And we're just doing some cheese dip and...
Get paper ones.
Yeah. Well, what makes you think they're better?
They're wider.
And they're probably a lot more. Hi, Mel. Yeah, and I got your thing, Mel, that you sent me, and we took a quick look at it. So we'll talk about that in a moment. And Jules is here. Hi, Jules. So I guess we'll get started with the preliminaries. Update on my mother. She got moved. Yes, same nursing home, but she's in a new room. I guess they hide. Hi, Julie. I guess she had, I guess there was somebody in the nursing home that they had to put in my mother's room because my mother's room was closest to the nurse's station. And this other person needed to be closer to the nurse's station. So they asked my mother if it's okay if she moved into this other room, all on the same floor. And I guess the lady who shares this room is very quiet, which would make my mother happy. Because her roommate that she had before had dementia, and well, according to my mother, was driving her nuts. But then most things drive my mother nuts. The room she's in now is a little smaller than the one she was in, but they said because they asked her to move that they've put her to the top of the list for a private room. Because I've had her on the list for a private room. They don't have that many in the nursing home that she's at, so maybe soon she'll get into that. But of course, I had to phone up Bell, that's our internet, telephone provider, and to get everything moved to her new room. And I'm going to talk tomorrow on my vlog a little bit about that when I do what I'm pissed off at this week, because there's well, I don't know if it's an interesting story, but it's a frustrating story. Every time I have to deal with them, the simplest of things become very complicated. But long story short, she's moved, she's settled, everything is working, so there we go.
Do you have to sit that high up?
What are you? Jeez. Did your mother have any children that lived? Apparently not. Correct. Okay, my straw is still sticking. Okay, so what else? Oh, you should have brought your fabric out. Your Juicy Juice.
Oh yeah, wow.
Walter ordered fabric online from a designer that works for Andover Fabrics in the States. He goes by the name of Juicy Juice, and it's very, very contemporary. It's kind of interesting. So he's gone off to get it now to show you what it looks like.
Well, I won't take the colors. I'll just...
What you're not going to do? Well, I don't know what he's talking about. Anyways, it's kind of nice material. But I think you really need to do what they call a modern quilt with this fabric and finding a pattern. If you don't create one yourself, that would like really show the fabric off in full beauty. What?
I have solid colors too in this fabric, but I didn't bring it out. I got solid colors because they're just solid colors, right?
Mm-hmm.
So there's a panel. Oh, jeez. There's actually 2 panels here, so anyway.
All right, there's one.
I don't know if you can see that. It's a panel.
Yeah, you turn it this way a little bit. There you go.
Actually, it was more like this way. Okay, see what I'm doing.
Well, I can, yeah, there you go. So it's kind of a neat geometric shapes, but the colors are kind of cool in that. Now that's a panel as opposed to just a repeated print. But then you've got these other things.
And there's a repeated print that goes with that, which is kind of interesting. It's all like geometric shapes.
And there's little hints of color. It's hard to see on video, but there's little dots of color in the patterning.
So like there's little hints of color here and stuff. Then there's solid fabrics that go with it that are similar in design. Solid
Actually,
colors.
and price wasn't bad considering you had to pay shipping and there's the exchange rate on it. And it actually worked out well in around the same price that we pay for fabric here.
Pretty much, actually, and in the cheap places.
Yeah. So that wasn't too bad. He got some other solids and things to go with it, so it can make probably a really interesting quilt. Tracy says it reminds me of good LSD trip. Groovy. I suppose. Mel says nice fabrics. But anyways, so we got those the other day. And there hasn't been a lot else happening in the past week, actually. No, we haven't done anything too exciting in the last little while.
About your mother's teeth.
Oh, yeah, my mother's teeth. Forgot about that. Okay, you know, a few weeks ago I mentioned that my mother thought she had lost her bottom teeth, and not her real ones, obviously, like her dentures, and we found them in her wheelchair. Well, we went over last Tuesday to see her, as we usually do, and I'm just asking her, I said, so how are your teeth feeling? Because figuring, do I have to get the dentures in to do an adjustment again? And she says, well, take a look, and she opens up her mouth, and I call her mouth the black hole of Calcutta. You do not want to kiss that woman on the lips. I can tell you that. She's got only about 6 teeth in her head to start with, and they're not in great shape. That's why we have the dentures. Anyway, she doesn't have the bottom dentures in. Well, she didn't have the tops in either. I said, okay, where are they? She says, funny story.
Giving up on straw.
She basically was down for dinner. Now, this was supposedly happened the Friday before we were over there. Her teeth were bugging her. She took out her bottom plate and she rolled it up in a serviette. Then when she left the dining room, she forgot to take her teeth with her. So she mentioned it to the help. The help went down and thought, well, it might have gotten rolled up in a tablecloth because they take the tablecloths after the meals, right? And roll all them up to wash them and everything. So they checked with the kitchen staff. Kitchen staff didn't see them. And I said to Mom, and so you talked to them last Friday. This is now Tuesday, so 4 days later when I'm hearing about this. So I said, well, I'll go and ask and inquire at the nurse's stand about this. Now, the thing is, my mother hates her bottom dentures. Absolutely hates them. They hurt her. she says. Well, they're like a new pair of shoes. Yes, they are going to hurt for a little while until they get the bugs worked out, kind of a thing. Get them positioned correctly. And that's what the denturist said. And he's been in twice to check them and do whatever he has to do to adjust them. And he said, I told my mother, you have to leave them in for a while. He says, even if they hurt a little bit, leave them in as long as you can stand it. Because then when he comes and checks her, he'll see where the wear marks are, where it's rubbing. And he'll know how to adjust them. Of course, my mother doesn't do that. So I went out to the nurse's station and I said, so my mother says she rolled her teeth up in a serviette and it possibly she left them behind the dining room. And she says, yeah, she just told us about that today. I said, apparently this happened last Friday. And no, we just found out about it today. I went, well, that's not good. And she said, now we did check down in the kitchen with the kitchen staff. They didn't find anything. And she says, but I'll call down to the laundry room to see, that's where they do the tablecloths and everything. So meanwhile, I'll go back into my mother's room and I know what really has gone on. My mother is a passive aggressive. She purposely rolled them up in a thing and purposely forgot them. She wanted them to go missing. She hates them. And
like a little kid.
Like a little kid, yeah. My mother is crafty like that. Sinister, actually, I would say. But so anyways, I'm talking to her about them and the nurse came in and she says, yep, call down, they're not there. And she was very apologetic, about not finding them. I said, it's not your fault. I mean, you can't be expected, the staff can't be expected to go through every serviette that's on a table. Like, God, no, I wouldn't be doing that. What's in those serviettes is staying in those serviettes, and I'm not poking through them. And
so they're probably just going around with a garbage bin and just going like this.
Just scooping it all off. I'm
yeah.
sure they are with it all. And I don't find any fault with that. It's not their fault. So I said to my mother, okay, well, I can phone up the dentist place and ask how much to get a new set, like a bottom plate made. And I'm going to ask them about insurance to see if there is such a thing as an insurance policy you can pay for monthly or whatever that covers loss. I don't think there is, but I thought I'd give it a try. And I said to my mother too, well, are you going to wear them? Kind of a thing. Well, she didn't really answer that directly, which means no. So I did call $1,850 Canadian to get a new set. That's just for the bottoms. And no insurance. And I said, okay, well, I'm not going to order her a new set right now. I'll talk to her about this. I mean, my mother's got enough money to keep her in this residence for the rest of her life. However, she doesn't have that much money for throwing around, especially if you're going to throw out your teeth. And I do believe that she did this on purpose. My mother doesn't have dementia. She knows what she's doing, and she's sneaky. So I told my mother what it would cost and whatnot, and she was hemming and hawing about it. And I says, look, Mom, we can just leave it for a while and see how you make out with just the top ones, because you were complaining that the other ones were hurting you. And I didn't want to get into it with her, but I could have turned and said, and Mom, we know when you don't want something, this is the passive part of it, she will find a way to make it somebody else's fault for why they're not there. So, like she took them out.
Says Steven, does Mom play martyr?
Oh, does she? Yes. Give her a crucifix for God's sakes and string her up. I mean, holy crap, she's got nothing on Christ, I can tell you that. She plays martyr all the time. But it was her idea to get the teeth in the first place. I wasn't pushing these on her or anything like that. And I said to her, do you want them? Now, I thought it wasn't a bad idea for her to have it because, chewing your food and things like that, you need a set of teeth, really, for it. And I mean, what she doesn't realize yet is if anything happens to the last 6 teeth she's got in her head, if they have to pull those and she doesn't go for another plate or something down below, they're going to be pureeing her food. They're going to take those...
Mind you, if they pull the other teeth, She won't. So she'd have a full plate with all teeth in the bottom that that they're easier to put in and take in.
Yeah, but you know my mother.
Yeah.
Like, actually, my mother would have worn them. Here's the problem. My mother doesn't want to do anything for herself. And I mean that. I mean, it's true. You know that she's in the nursing home simply because she decided to stop walking. We've discussed that before. When they come around with her pills, and this just disgusts me to no end. They come around with her pills in a little cup. She goes like this. She goes and opens her mouth for them to throw them in. Some of the nurses will. Some of the nurses don't. They'll take her hand and put the cup in her hand. And rightly so. She is capable of putting her own pills in her mouth. She's not paralyzed. She can grab things. She doesn't have a problem like that. But everything is effort for my mother. When I call my mother, sometimes I let the phone ring 15 times before I hang up to give her a chance to get to it. The phone can be 2 inches out of her reach and she won't even try to reach it. She's in a wheelchair. She won't push herself. The staff have to do it. The old lady who is 98 years old that was in her old room, who has dementia, pedals herself all over the place in her wheelchair. No problem. I mean, she's crazy, but there's no problem as far as her mobility. My mother could do the same, but she won't. She watches one channel on TV. Why? Because it's effort to pick up the remote control and change the channel. That's what I'm dealing with, okay? I have no idea why she is this way. She wasn't this way when I was a kid or when she was in her 40s and her 50s, 60s even. She drove her own car, she was fairly independent, she did things around the house and everything like that. So, I mean, this may be a manifestation of depression after my father passed away. But lots of people lose a spouse at that age. And yes, you go through depression, but
what I don't understand is why you wouldn't have the will to actually, if all you do is watch TV, learn how to change your stations, right?
yeah, like it's just all. Now we went over there to check yesterday that everything got set up properly in her room. Actually, I was surprised because I figured we'd go over there and they would have probably taken all her stuff, thrown it in the foot of the bed because they didn't have time to get it all reset up, and we'd go over and have to do all of that. But actually,
I don't know. I kind of figure that it's not that obvious, but it seems to me that she's suffering from an early type dementia or a form of type dementia. It's not as obvious as like the dementia that my mother had or something.
Yeah, well, maybe she is. But I think what I'm going to do is I'm going to give a call to the nurse practitioner that sees her on a regular basis, and I'm going to ask that question. I'm going to say, do you think, is there a form of dementia where, and I'll tell them the situation. The nurses are under no illusion about my mother's abilities and capabilities. They know, because when I talk to them over there, first of all, they're very polite and they're very cautious when they speak to me, because lots of people come in there, they've got a loved one in the home, and they don't want to upset you, or they don't want to say what the reality is because they're afraid you're going to fly off the handle at them. I don't. I say, look, I know exactly what she's like, so and then when I tell them that, they kind of then tell me what they know, and it's no surprise to me. I know that my mother is difficult for them, but they are trained professionals and they're used to dealing with difficult people, but nevertheless. So anyways, she was sitting in her wheelchair, and I guess they'd put the little footrests on the wheelchair for her. Well, she was complaining about those. I don't know what they doing that, why they're doing that. Well, I can tell you why. When they push her out to get her down for meals and things like that, she doesn't hold her feet up. She lets them drag. And she wears soft-soled, like running shoe kind of shoe. And of course, they're rubber, so they hit the floor and everybody goes tit over ass kind of a thing with that. She's done it to me. I've said, Mom, keep your feet up. So she's complaining about these things. And so I said, well, I'll take them off. I mean, they just snap on, snap off. So I took them off, And you know, if the
See,
staff,
the thing is, she originally had that wheelchair because her feet would touch the ground, so that she could use her feet to help her move the wheelchair. But she doesn't do it.
she won't do
move
it.
She won't even try.
No.
She says, "Oh, the wheelchair is too hard to move." She's expecting it to be motor, and then she's looked at a motorized one
Yeah.
and said, "Oh, how do I get one of those?"
Oh God.
Oh my God, she can't change her TV remote. How's she gonna do?
That's right. So, anyways, that was what we've been going through with her lately, and yeah, it's just added to.
No,
The
President
experience.
says maybe she's depressed about getting old.
Oh, I think she is. I think she's depressed. She's on an antidepressant, actually. In fact, they upped her dosage. It was
It actually made her a little better because she actually went out to a couple of activities.
yeah.
Whereas before she wasn't even doing that.
She wasn't doing that. So yeah,
And what else she wasn't? What she was doing is laying in bed all day.
but they won't let her do that, and that pisses her off. Because they want to keep her moving, right? So I don't know. Yeah, she's definitely. I know she's suffering from some depression, but I
The
think.
President says CBD oil.
Yeah, I've heard that. I've heard good things about that.
Yeah, drop her a gummy.
Yeah, drop her a gummy, and next thing she'll be kicking her heels up and having a good time. Actually, if I thought that would actually help, I would do it. But I mean, after all, it's legal here. So, but I think I will put a call into the nurse practitioner next week and talk about this kind of stuff, because not that I think they can do much about it, but I don't know. Just the way she is.
Well, they can get her evaluated as well. So
Well, yeah, they can. But even, okay, but let's put it this way. Let's say this is a form of dementia, okay?
Yeah.
So what's the... What are they going to do for it? They're going
Not
to put her
much.
on some kind of more medication? Funny, this should lead into today's discussion about healthcare systems. And now Julie and I had a little conversation, and we were kind of not diametrically opposed, but we view the healthcare, or at least doctors, in different ways. Julie's had really positive experiences with the doctor, especially with her husband, and she told me that, you know, thanks to medication and things, it's really helped a lot for her husband, for his situation. Whereas my point of view was that I'm never sure about medication. Not that I won't take it for what I've got, but I sometimes wonder, you know, are doctors, at least here in our country, in our area, are they influenced by the pharmaceutical companies and salesmen that come in? But we're going to save that discussion because I know Julie has an opinion about it, which is well worth hearing when we get into that. But let's just start. This week's topic is healthcare system, and I subtitled it, Are We Dying for It? Okay, let's start with what our healthcare system is like, because there's a lot of myths about Canada's healthcare system. You often hear, especially Americans, because Americans are always fighting about what kind of healthcare they should have in their country. Everybody thinks we have universal healthcare and we have a really great healthcare system and you don't pay for anything and everybody's treated the same. Not completely true. Our healthcare system is, I'm not even sure, when they use the term universal, to me the term universal means everybody, no matter race, creed, color, religion, economic status, sexual orientation, everybody gets full health care equally. There are not the haves and the have-nots. That's not true in our system.
Yes, it is. But it's the stuff that is covered is available to pretty much everybody.
But if it's truly universal, everything should be covered.
Yeah, but not everything is covered. Yeah.
So it's not truly universal. I mean, the word universal means all-encompassing. At least that's the way I define it.
No, but the way I define it is the health care that's available, that is included in your taxes, is available to everybody, regardless of their economic situation.
All right. But
Okay, so what we're saying is, okay, hospital care, regular visits to the doctor is covered, and emergency visits to
the
the hospital
hospital,
are covered, and
many
surgeries are covered.
many drugs are
Uh,
covered.
no, only drugs that are covered are when you're in the hospital.
Yeah, okay. Well, that's what I meant. But okay.
But our drugs are not covered if you're not in the hospital. Okay? So,
Well, no, that's not completely true. At 65,
no, hang on. I'm not done yet. Okay. With the exception of if you're 24 or under, they've recently, after the last couple of years, put in a plan so anyone 24 or under has access to about 400 fairly normal generic drugs. They're available. And then anyone over 65 has drugs covered, as well as the regular healthcare part. The other part that's not covered in Canada or in Ontario, we're talking about Ontario, because each province in this country has their own separate version of healthcare.
yeah.
So that gets a little bit more confusing, but let's just talk in general. And then what else is not covered is dental care. And the third thing that's not covered is cosmetic surgery.
Oh God, you mean I can't get a facelift for nothing?
Right. So if you're 600 pounds and you lose a pile of weight, right, and you need the tummy tuck,
Ooh,
it would have to be considered a medical reason to do that before they would do it in the hospital. If they consider it's just cosmetic and you can live with the extra flab, then they would charge you to have a tummy tuck.
Okay, so essentially, so how is that universal?
Well, it's
It's
universal as the parts of the healthcare that are covered by us, right? Then, or the other thing that's not covered is eyeglasses and eye care. The parts that are covered, right, are covered for everyone. It doesn't matter how rich you are or how poor you are.
So we have a healthcare system that has federal regulations and then provincial regulations. So there are two levels of healthcare, but the provinces are principally the provincial governments, that look after most of the healthcare for your particular province. So here in Ontario are, like Walter said, hospital, surgery, drugs associated with if you're in the hospital for, are covered. However, not all your drugs. Let's say you're a cancer patient, okay? And your cancer treatments and things are covered, but there are certain exceptions to that. And I'm not sure what those are, but I know it's not completely, no matter what kind of cancer you have.
Well, if you go
no
into the
hospital
hospital for cancer treatments and drugs are used for cancer in those treatments, they are covered in the hospital. But if you need other and more expensive drugs, there is a system available in Ontario that will cover what they call catastrophic drugs, which is like cancer drugs and stuff like that. Because we know, like, we have a friend that's HIV positive, and his drugs are covered by the provincial care.
Oh, and if you want a sex change, it's covered now too in Ontario. So come to Ontario and have a change.
Now, mind you, in Canada, it's not a blanket thing for Canada. If we travel to another province, then we actually have to pay, we may have to pay out of pocket if their health care covers different things than Ontario does.
But we can also, though, submit that back in our home province to see if they will cover part of it. It's not as straightforward as it might sound. You know, you hear everybody talking about universal health care is a right. And actually, I do agree with it. It should be a right. All people should get it, no matter what in the world. I mean, everybody in every country, in every world, pays some form of taxes, and that's how our health care is covered.
Yeah, I know.
Yes, but our taxes are high in Canada. But that's what we get for our money, too. So I don't mind paying higher taxes if I don't have to worry about mortgaging my house, because I had to go into the hospital. And that's what happens to a lot of Americans. Now, Tracy just said back up here, my health insurance, Tracy says, before Obamacare was $1,500 a month. After Obamacare, it was $500. But the point is, even with Obamacare, you're still having to pay $500 a month. We're not. Now, we do have an extra insurance policy. We'll talk about that in a minute. But they don't expect us every month to drop a certain amount of money. We don't have to do that. That comes out of our taxes with that. So, we're not surprised by a big bill.
But of course, like people that are working pay taxes and stuff like that, and then people that are on welfare don't pay as much taxes, but they still have the same access to the health care that we
So
have.
I guess that's the universal part of it. In the States, if you don't have insurance, you're screwed if you're poor people.
Well, they do have a sort of Medicare system, I think, of some sort.
But I don't think it's nothing like our system at all. I mean, that's what they're always comparing
okay, take
it to.
for instance my sister. She just recently had a gallbladder operation to remove her gallbladder.
Yeah, carry on.
So anyway,
I know I was there.
So anyway, she was having an attack. She went to see a doctor, and actually she went to the hospital, and they checked her out, and they found that she has gallstones. And then they put her onto a specialist that covers that, and they said to her that she needed her gallbladder removed, and so they scheduled her for gallbladder removal. But normally it would have been about a 2-month wait, but they had a cancellation, so they got her in a week within 2 weeks. And so, but anyway, so she had another bout of it just before the operation. She went to the hospital again. She had an attack, a gallbladder attack. They told her that she could get emergency surgery that night or wait till 4 days later when she had the surgery scheduled. So she waited for the surgery schedule. They gave her the surgery. She spent a night in the hospital. They sent her back home. All that was covered. The initial visit, everything else was covered. The whole hospital. She had, what do you call it? What's the surgery? Not endoscope.
The one that's not so evasive.
Yeah.
I never could say the word anyway. So, the one where they go in with like a scope thing and do a little incision, and that's all there is to it. Is they're not opening you right up to take all your guts out, kind of thing. It's less evasive, and I forget what they call it. But yeah. So your point was,
well, she had all that. She had her drugs that were in the hospital. She had the surgery. She had everything else, and there's zero charge.
she doesn't have a bill. But Tracy says, here's something interesting, and since I know you looked up the Ontario stuff, Tracy says, I know in Ontario, the most you can pay for health care in your taxes is $900 a year.
It's the most that you can pay in. No, that's not true.
I don't know what that means. The most you can pay in your taxes.
No, no, that's not true. That's that is not true. There is a thing that they can deduct. A part of your taxes that they say is Medicare is $60 a month, but that doesn't cover everything. We have taxes that cover healthcare that's more than that.
Maybe, Tracy, what do you mean? You mean like, as far as our tax dollars are concerned, the amount that is allocated by the government out of our overall taxes is $900, but it might cost you several thousand or something, but you still wouldn't pay here. But that may be how they allocate our taxes. I'm not sure if that's what you mean.
Well, actually, there's a little deduction that says Medicare on it when I do the taxation, and it says $600 for the year. But that isn't really what we're paying.
That's not really.
I think that's not really what's covering with our taxes. I think we pay a lot more in our taxes for healthcare than $600.
Well, we must, because the Ontario government is constantly, every new government that comes into play, there's two things they always attack to try and get out of debt. And that's one is the healthcare system, and the other is the education system, because those are the two biggest ticket items in our tax bill. But anyways, it's actually, you would think we would know more about it, but we don't. And there's a reason we don't. It's because if you were to sit down and read the legislation, which would be several volumes long, and try and figure it out through all the legal goop, you still wouldn't understand it. You need a lawyer to understand that stuff.
In actual fact, we don't really know how much of our taxes are going to healthcare.
No, we don't know. We do not have a breakdown of that. And even if you were to try and do a search and find a breakdown for that, you probably would find contradictory things about it, and it would all be written in such a way that it's not like, okay, this is the X amount of dollars that you pay. No, there would be formulas and things like that that never make any sense. So for the most part, as Canadians, we don't get too uptight about what we're paying for healthcare unless they present us with a bill. For example, I had to pay for ambulance for my mother when I transported her from the hospital to the nursing home because I had to hire a private ambulance service because it wasn't deemed an emergency, a life and death emergency. But when she was taken to the hospital, we had to pay. We didn't have to pay.
No, we do. You do have to pay.
But we did have to pay
an ambulance because they're trying to keep people from misusing the system.
Yeah, I guess we did pay for
so
when
it's
she
$45 to go.
Yeah, it's $45. Not a lot of money. So it could be worse.
They don't cover certain weird things like if you need, they'll give you crutches if you need crutches, but if you need what do you call it, a removable cast, they may charge you for the cast.
Yeah. Now, Julie says that in the United Kingdom, everything is free because they have the National Health Service. So that means any kind of drugs, any kind of treatment. What about dental? I'm curious about dental because our dental is not covered by our healthcare system. You need to have private insurance for that or have a lot of money because dental stuff is not cheap. So how does that work in the United Kingdom, Julie?
And also eyeglasses are not covered here.
Oh yeah. Well, neither are eye exams. It used to be an eye exam was covered, but a few years ago, our Ontario government got rid of that. And when I go and get my eyes checked every year, it costs me $50 up front for the exam. It costs me another $50 because I'm considered a risk for glaucoma because my mother has glaucoma. So they have this pressure test that they do. Or in some cases, a thing that takes a picture of your eyeball and they can compare it and see things. And that one, you have the option of saying, no, you don't want that test. But because my mother has glaucoma and it can be hereditary, I have the test. That costs me another $50. So every time I go to the eye doctor, I don't get out of there for under $100 minimum. My glasses are not covered. We have a health insurance plan, a private one that we pay into every month, but they only cover how much on glasses? $350 every 2 years or something?
Yeah.
Which I don't know if you've bought glasses in the last little while, but like these ones that are sitting on my face right now, you're looking at $1,300 worth of glasses. Okay? And that's not...
Mind you, you're buying premium glasses.
Yeah, but I mean, that's not because of the frames. That's the lenses themselves.
Yeah, but you're buying premium lenses.
Well, I gotta see.
They're compressed and everything.
Well, yeah. Otherwise,
I'm sure you can get cheaper lenses. They're just... Meliart says, here, dental care is mostly covered. You pay 20 to 40 euros max per treatment.
So 20 to 40 euros, that's what, about $40 to $80 in our money? That's not bad.
Under the dental plan I have right now is that, how much is it covered? We have a...
What, for our plan?
I think it's
it covers about 85% of most procedures, but...
But if you need a crown, or if you need a crown, or if you need something like an implant or something like that, implants aren't covered. But if you need a crown, then it's only covered by 50%.
Yeah, Precy says I'll email you the stats from my Ontario friend.
I'll look that up. I haven't
Yeah.
actually looked it up as to what percentage of our taxes go to healthcare, but I have a feeling it's more than that. It may be just there is a nominal. They tried to put in a nominal fee at one point in time for the average person that was not employed with a employer that will pay. They called it employer health tax.
Yeah.
They charged employers a tax for their. That's what it was.
Yeah.
The $60 a month was something called employer health tax. If you were working for an employer, they would have to pay that for each individual.
Well, Tracy says, try Zini Optical for super cheap glasses. Tracy, don't take offense to what I'm about to say to you. You come up with a lot of things, and you're very American. You really don't have a concept of what little we have in Canada compared to what Americans have when it comes to consumer choices. We don't have a Zini Optical in Canada. We have a tenth of the brand names and the stores that you have in the United States.
Yeah, we can get cheap glasses here. There's no doubt. You can get cheaper glasses than $1,300, and you can get cheaper glasses. It's just that he's wearing a premium pair of glasses.
Well, she says Zini Optical is online, but they're probably an American company. So we would have to pay the exchange rate. We would have to probably pay some kind of shipping. We might even have to pay duty for that kind of thing. Americans seem
$6 for glasses.
Americans seem to think that because we're attached to North America as Canadians, that everything that happens in the States is the same as in Canada. It is not.
Well, there's no way that he would get his glasses for $6.
No, not because of my eyes. You know, there's no way.
It's just like the glasses that I wear. I have a minus 6. I have a minus 6 in one eye and a minus 7 in the other eye. I wear contact lenses, and I know the glasses. If I get just glasses ground, they cost about $300 for glasses. For just the lenses.
Yeah, I could get really cheap frames, okay, but you get what you pay for. I'm hard on my glasses. I don't need to wear my glasses all the time. I only need them for reading. I had my cataracts done a few years ago. They put in my eyes my actual prescription. I wore corrective lenses since I was 11 years old. I had Coke bottle bottom glasses. They wouldn't let me in a forest on a sunny day because I would start fires. It was that bad. And then I went to contact lenses, and I wore those for over 35 years or longer. Probably a little longer. And then when they did my cataracts, that was the best thing I ever had happen. By the way, it didn't cost me anything for my cataracts, but it did cost me to upgrade my lenses to my prescription at that time. And I think it cost me about $200 an eye. Now, something changed because Walter's brother-in-law had cataracts done not so long ago, and they had all these different ranges of prices for doing what I had done, which went up to about $1,500 an eye or something like that. So I don't know what changed in our healthcare system. And that's the problem with our healthcare system. It changes, and it changes subtly. You don't know. They don't make a big announcement and say, okay, this is no longer covered. They suddenly, something that was covered last year for you, you go in and find out it's not covered this year. Like what I was telling you about in my vlog earlier, last week. And this is what Julie was making some comments about, because I went on a little rant about how I feel about our doctors in our system. Well, basically, my doctor put me on blood pressure pills, right? I am not against taking the blood pressure pills. If I need them, I trust my doctor. She's very good. She's very thorough, more so than what I was used to, because my other doctor that I had for 40 years retired. I saw him once every 3 years, and he said, yeah, you look good, fine, move on. Any problems? She's very thorough. So she said I had a blood pressure problem. She put me on this drug. I went in to renew the drug. Now, last time I got my drug, I get 3 months worth of these pills. They cost about $158 for 3 months worth. But we have an insurance plan that we pay into every month, and I only have to pay 10% of that. So fine, I paid like $15 last time I went in. Went in to renew it, and suddenly said it'll be $129. And I went, what? And I thought, well, there's been a mistake. You realize, I said, I have an insurance plan. And they're looking at it and going, yeah, but no, that's your insurance company only covered $20 of it. I said, well, this isn't right. Well, I mean, not the pharmacy's fault or the guy I was dealing with in the pharmacy's fault. So I just paid the $129. We came home. Walter checked it out online and everything. And yes, my insurance company does cover that drug as long as it's generic. You see, we can have two types of drugs. We can have brand name or we can have the generic product. If you get the generic product, if there's one available, the insurance company covers 90% of the cost. But if there's a generic product available, but you decide to go with the brand name for it, they will only cover about 10% of it, and you have to cover 90%. And that's what happened. When I got the drug the first time, there wasn't a generic for it. The next time I went in, they had just come out with a generic. But Shoppers Drug Mart didn't seem to kick in on that. They should have automatically given me the generic. Anyways, got that sorted out, went back with the drugs. I hadn't opened them and said, here's the situation, and no problem, they gave me the generic. I paid $6.19 for a 3-month supply as opposed to $129. So this is the thing. You've got to watch what our government is doing, what they will cover and what they won't cover, and they don't always tell you
Well,
up
not only
front.
that, the drug plan that I have is a co-pay plan. For my previous employer, they pay half of the plan, and I pay half the plan. That just started in 2017. Before that, anybody that retired before that got their plan paid for by the original account. Okay, there's places here that you can get cheap glasses. There's places.
Okay, let me get on this right now, people. I'm going to tell you something right now. I won't buy cheap glasses. I pay for them. I'm not complaining about what I pay for them. If I was really concerned, I'd buy the cheap glasses. I'm not buying cheap glasses. The frames I have on here right now were over $700. I have sat on them. I have dropped them. I have snapped a piece off and realized that it just snaps back on. Best frames I've ever owned in my life.
Not only that,
they're worth the $700 to $800 I paid for them.
Not only that, he goes to the store and they custom fit them. Mm-hmm. And if he has any problems with them not fitting properly, he goes back and they readjust them and readjust them at no charge. So that's why he's buying a quality pair of glasses. Yeah, if you're down and out and you can't afford a pair of glasses like he's got, there's cheaper options for you to buy cheaper glasses.
There are certain things in this world that I will not compromise just because they're cheaper. I will pay the money, but that's on me, and that's okay. I'm not complaining about paying that money. I don't expect the government to come in and say, sure, you go out and buy yourself $2,000 designer glasses, we'll cover it. I don't expect that from my government, okay? Never have. But yeah, I won't be dealing with the ones online. I'm not getting $6.99 glasses. If that works for other people, that's fine. Whatever. It just won't work for me. Simple as that. So we don't need to be talking about glasses because really our whole discussion today is more about healthcare and we're diverting from that. So what we want to talk about too is what's a typical hospital stay look like? What are our hospitals like in Canada? Well, we think they're shitty. But by comparison to other places in the world, they're probably pretty good. I know in the States, or at least from what I've heard in the States, that you have a two-tiered system. There's private hospitals and, for lack of a better word, I don't know if you would call them this or not, but public hospitals. And the public hospitals are where the people who don't have the money or only have a certain amount of coverage go. The private hospitals are more for the elite. And it always seems funny to me that you watch television shows and they always show these beautiful rooms that people are in hospitals. They're bright, they're airy, there's one person in the room, there's fresh flowers sitting in a side, and the food looks edible. Well, I know it's television. But in this country, that's not what they look like. Our hospitals are overcrowded. We have something called hallway medicine, thanks to our government who wants to keep cutting back on hallway stuff. So there could be people basically are in the hospital and they don't have a room for them. They're on a gurney in a hallway. Now, I don't want to suggest that you'd walk down the halls of any hospital in Canada and you're going to see all kinds of beds out in the hallway and everything like that. No, it's not like that. But there are some cases where, yeah, some people have to wait for a room and they're on a gurney and they don't have a room for them or whatever.
I mean, when your mom went to the hospital, they admitted her. There was a room available for her, so.
Yeah, she was lucky. And I have never been in a hospital where I've seen rows and rows of beds down the hallway, okay? But if you listen to our media, they want to make it sound like that's the way it is, or the critics of the government, that that's the way it is. Yeah, there's other areas, though, that are more subtle that they could improve on. One, hospital food. Sucks. Bad. I mean, it almost makes airline food look good. Almost. They're understaffed, and the nurses that work in our hospitals, I don't know how they manage. I really don't. They have the patience of saints, and sick people are not happy people, so they get abused and they just keep on with their job, and there's not enough of them to do that. And that's been an ongoing, every time there's an election, that's one of the issues. More money into healthcare. So our system is not ideal, but in comparison to a lot of countries in the world, it's very good. And Mel sent me a thing about the best healthcare in the world 2019. And I was looking this over, and it says that Finland has the best, then Norway, then Sweden, then Canada. However, Walter looked up a couple of other reports. One of them said France has the best healthcare, and Canada was about 39th on the list. We're all beating the States, though. I mean, they're way down and low on the list according to whichever one you read. So it depends on how they define what is good healthcare, okay, by these statistics. So we looked at 3 different reports. 3 different reports have 3 different answers.
It depends on what they're judging it by.
And what do they judge it by?
What's that one judging it by?
I don't know. It says, okay, one of the best ways to determine the nations with the best healthcare is by taking a look at the 2019 Best Countries Report from U.S. News and World Report. In this report, the sub-ranking of quality of life includes the attribute of having a well-developed public health system. And that's all they say. What's a well-developed public health system? I mean, we would have politicians, because it is politics, we would have politicians argue that a good healthcare system is one where people are being looked after in a humane way, and wait times in hospitals and for surgery is less than 2 years. Whereas others would say, no, a sign of a really good healthcare system is wait times in a hospital and surgery is less than 2 weeks. What's the standard? Is there a standard? I don't know.
I know that if you have an emergency, they do get you in there as soon as they can.
Hi, Andy. Yeah, if there's an emergency, actually, one way to circumvent the system is go to emergency, have an ambulance pick you up if you've got a problem and take you to the hospital. You are immediately moved up on the list of when you're going to get looked at in emergency. Emergencies in our country, emergency wards, sections, are always overflowing with people. And the reason for that is because we have a lack of doctors in our country. Why do we have a lack of doctors in our country? Because our doctors are paid by our healthcare system, but they are only allowed to bill so much over a certain period of time. So they limit the number of patients that they will take in. And a lot of doctors will get their education in this country and they will go to private hospitals, private practices in other countries, i.e. for Canadians, the closest ones are the American system.
Well, the other thing that we don't have here is we don't have malpractice suits here.
No, Americans have to take out massive amounts of insurance the doctors,
I knew
because
a
of that.
couple of doctors that went down to the United States and then ended up coming back to Canada because they didn't have to deal with malpractice insurance and stuff like that. So, and the doctors here, actually, one thing that I read that was looking at this stuff before we went on. One thing also said that that doctors here do not work directly for the government. They work for themselves and they bill the government their services.
Yeah. Now, Mel says that report includes also the results from the Prosperity Index released by the Legnum Institute, and in that, Canada is number one. Best countries report from U.S. News and World Report lists Finland is number one. Yeah, but what I'm saying is there are all kinds of reports that are written and tell you what the ranking is, but no two reports will tell you exactly the same thing.
Like if you have a problem with your medical situation in Canada, if let's say you've got a doctor that you thought screwed up or something, like
and that's what Pricey's asking.
Right? What you have to do is you have to make a formal complaint to the College of Physicians, and they put up a tribunal or whatever to decide whether you have a case or not to be able to.
However, they probably won't do it unless you have money, unless you can hire a lawyer to act as your liaison between.
It has to be a blatant.
They'd have to kill you.
Yeah.
And then what does it matter? With it in the States, they sue over everything. So malpractice insurance, from what I have heard, is extremely expensive. And someone said here, Andy said, Illinois has been losing doctors because of the cost of insurance. Because everybody sues everybody in the States. We know that. That's pretty much a fact. It's been going on for years. With that, in Canada, it's not the same.
It's not so easy.
It's not so easy to do that, even beyond the medical world. So if a doctor screws up, like Walter says, the only recourse you really have is to put in a formal complaint with the College of Physicians. Now, it does have a certain effect because my mother had a doctor who was a piece of crap, quite frankly. She couldn't do too little. And I needed stuff from her and like forms signed, especially when I was trying to get my mother on the waiting list for a nursing home and that. And she would never return calls. Her office wouldn't. They kept losing the forms, all this kind of stuff. Finally, long story short, and this is one reason why I do not have a great love for the medical profession. And Julie, that's probably where the comments I made on Monday, that's where they're really coming from. I had to threaten that I was going to take that doctor to the College of Physicians. Suddenly she calls me. She can't do too much for me at all. She didn't want me to call the College of Physicians. Now, as an aside note for this, many of our doctors that we have in our country now are not, I don't want to sound racist, are not Native Canadians, okay? Meaning that they're immigrants. They've got their education somewhere else and have come to this country. Fine and dandy. I said we have a shortage of doctors, so we need doctors. But there's a lot that come here and don't get a license. So the reason this particular doctor was, I don't know.
They have to have a license to be able to practice here.
Yes, they have to have a license to practice here, but I'm not sure what the stages are for the license. There are degrees of licenses. And I mean, there may be a probationary period when they first come and get their license.
Well, I've heard that they've got, it takes them a long time to get relicensed there.
So I don't know. But she seemed to go right into action when I said that about going to the College of Physicians.
Yeah, well.
So I don't know why suddenly I got a reaction from her from that, but I did, and it got me what I needed, so there we go. But I didn't like her at all. I didn't like the specialists. Hey, let's talk. Okay, let's talk a little bit about doctors, because I talked a little bit about this on my vlog on Monday and why I'm suspicious of doctors. Okay, I had said, and Julie picked up on this. I'll just wait till his nibs stops the blender. I had said that.
Oops.
We'll just wait. can't get good help anymore, really. Jeez. Doctors, to me, are a bit of a pill pusher. Now, before Julie jumps on my neck on this one, because she already has, what I mean by that is general practitioners. Yes, they're very smart people. Yes, they've had many, many years of schooling and education. They have many more years of practice and that kind of thing. I am not questioning their professional ability to do their job. What I do question is, oh, you got it on my...
Yeah, I told you that.
Jeez. What I am questioning is, they can't possibly know everything there is to know about pharmacology. For a simple reason. They are trained in drugs, but not in every drug. Thank you. If you hadn't been screwing around. Jeez. All right. What was I saying? Okay. How could they know everything about every drug that's on the market? Pharmaceutical companies are coming out with new drugs all the time. So where do they get their knowledge from it? Yes, many doctors keep up on the latest medical journals and literature. They have to. They're professionals. That's kind of what they have to do with their job, because medical science is changing all the time. I get that. As a teacher, I had to do the same thing. Okay? I was a professional. So I understand that. Two, there are so many reports that are written about all the new drugs, and they contradict each other. Because basically, once these companies get these drugs approved by whichever body in their country approves their drugs, they don't have all the information. For example, I have been on Crestor for 20 years, probably, because I got diagnosed as having a cholesterol problem. Fine. Yes, the drug has worked. It has actually done what it's supposed to do. It's reduced my cholesterol to an acceptable level, and it's fine. I'm on it for life. That's fine. But we don't know if I'm going to grow a couple of horns and one of my arms is going to drop off in another 20 years' time because of the effects of that drug. Because they don't know what the long-term effects are, because we haven't got to that point yet. So it's like, you know, how they tell you one year that coffee's bad for you, it's a carcinogenic, then the next year you say, oh, coffee is actually good for you. And they keep changing it, or chocolate, or whatever. Because they don't really know for sure, because it hasn't been on the market long enough to know. Meanwhile, pharmaceutical companies want to make big bucks. So they develop these new drugs, and that is why the insurance companies will only cover the generic more so than the brand name, because the brand names are an astronomical amount of money. Let's go back to the AIDS crisis in the 80s and the 90s. And they came out, they wouldn't stick. The pharmaceutical companies, actually the government wouldn't do anything about AIDS or HIV or anything because it would cost money to do the research. It took private drug companies to research it and to develop drugs to help fight the disease. The thing was, they weren't doing it because they wanted to cure people. They did it because they saw a whole new market that was going to make them billions. So they came out with ATZ.
AZT.
Or AZT, whatever. AZT, for a little while, seemed like the greatest drug in the world. It was helping AIDS patients. Problem was, it was also killing them as well. It was not the solution. So they continued to work on it and develop other drugs. Is HIV and AIDS cured now? No, it is not. But people have forgotten that. But people are living longer with it because there has been drug development. But they're paying through the teeth for that drug. There is a preventative drug that they had in the United States now for several years, and you can get it in Canada. It's called PrEP. That's what it's called, right?
Yeah, well, it's PrEP is a generic term, but there is a what do you call it? There's several different kinds of drugs that'll do the same
Anyways,
thing.
it's
Like Truvada.
it's a preventative drug. In other words, you take this drug, It reduces your chances of getting infected with HIV. Reduces your chances. Does not necessarily eliminate the possibility of getting it. So a lot of people are going on that drug. People who are extremely sexually active, and yes, in the gay community especially, with it. But that drug is not covered in our country, is it? And it's not covered in the States.
It is actually covered by a lot of drug plans here.
Is it?
Yeah. And I'm not sure if the provincial plan will cover it or not.
But the point is, these pharmaceutical companies come into your doctor, the salespeople, and go, okay, we have this new drug, blah, 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 blah. You might be interested in it because it can help your patients to have this, 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 and this, and this. And then there's all this list of side effects. And the doctors, basically, that's their source of information. And they go, okay, my doctor, for example, I wasn't always on Crestor. I was on Lipitor for a long time. Suddenly, out of the blue, he says, okay, I'm going to give you a prescription for Crestor. And I said, why are you changing my prescription? I've been on this other one for the last 10 years. It's been working fine. And he said to me, oh, well, Lipitor helps cholesterol, keeps cholesterol from sticking to your tubes in your heart, whatever, whereas Crestor actually eliminates it. That was the excuse he gave me. And he gave me a special card so that I could get the Crestor. I'd get the brand name, but I'd be paying generic price. It was something that came from the pharmaceutical company. It was like getting a coupon. And ever since then, I have been on Crestor. Yes, it seems to work. Okay. Does it have side effects? Yes, it does.
Yeah, Julie says cholesterol can be lowered by diet alone. Yes, we've tried that.
When I first got diagnosed with Crestor, or with cholesterol problem, my doctor said, okay, you can probably, if you alter your diet, you can probably control it that way, or you take pills. And at the time I said, I don't want any pills, I will go with diet. And I did. We cut out all kinds of fat, we did all kinds of things, and I did reduce it. But after a few years of that, it wasn't going down any lower. It was still in the range where, for them, and those numbers keep changing all the time, by the way, as to what's good and what's bad and whatnot. And I finally said, okay, I've done everything I possibly could do diet-wise. Give me the pills. And that's how I got on the pills. You cannot, if you absolutely stop eating, you can probably control your cholesterol, but you'll live for 4 days. Okay, so...
And you won't eat anything nice.
No. No, like really, if you want to sit around and suck on a toothpick and a glass of water, that kind of thing.
Well, the other thing that have been in the news recently, too, is that there's been Americans coming up to Canada to get their prescriptions for insulin refilled. And I don't know what it costs in Canada, really, because I'm not on insulin, and I don't know what it costs in the United States for insulin, but they're claiming that a 3-month supply they can save, or a 6-month supply they can save $10,000 or something. I have no idea. I know that a lot of our drugs in Canada are generic drugs, and that's because the government pushes for the cheapest cost on drugs, because they have to pay money for that.
Yeah.
And there's more control here.
Okay, I'm just looking at what people have been saying here. Tracy says doctors deal with symptoms and not cure the drug companies. Yes, that's true. But then couldn't we classify that as preventative medicine?
Yeah, my doctor put me on cholesterol pills because she's figuring that what are my chances for a heart attack? So she's got my family history, blah, 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 and all this other stuff. And she's got me down that I have a 14% chance of a heart attack. So she's decided that I have to go on cholesterol pills.
Julie says cholesterol can be lowered by diet alone. Well, we've already addressed that. And no, it can't be. Okay? It helps. Yes, and Tracy says diet and exercise, or Mel says diet and exercise. Of course, diet and exercise. We know that it's good to get regular exercise, and it's good to watch what you're eating in your diet. However, both of those things are easier said than done in our modern society. If you want to go out and chew on tree bark every day, then be my guest with it. And I mean, sometimes you have to balance quality of life with, being absolutely worried that tomorrow you're going to kick over from a heart attack. And by the way, I've known many people who were the healthiest people you would ever find in the world, who regularly exercised, watched their diet and the whole bit, and did exactly that. Dropped dead from a heart
like
attack.
for instance, my boss never ever had a cholesterol problem. He was fairly thin. He exercised all the time, had a fairly good diet, and as far as I could tell, and he all of a sudden had a massive heart attack. And it was after he had the heart attack, they put him on cholesterol pills. And he says, "But doctor, I've never had a cholesterol problem." He goes, "Well, you do now."
And this is the thing too. Doctors don't know everything, and we're at their whim because we're not doctors. I haven't had any medical training. I don't know any of this stuff, so I'm dependent upon their professional knowledge and opinion. And so I'm putting my faith, my blind faith, into what my doctor says. However, I also realize something, that they are human too. Like, for example, do you go into your doctor's office, or if you're looking for a new doctor, and say, "Excuse me, what were your marks in medical school?" Anybody ever done that before? Have you ever thought about it? How do doctors get their medical degree? Okay? Were you at the top of your class, or were you just mediocre? Does it mean that a doctor that got an A, as opposed to a doctor that got a C, I'm oversimplifying it, I know, is a better doctor? But you never know that. How would you know that? We don't. And you could ask, but you're never going to be told, are you? So, we're going in on blind faith because, just like everything in our society, we have professionals. We have specialists. We trust the specialists. We would never defend ourselves in a court of law because we have lawyers for that, because they're the ones that know the law, right? We will not try to do our own open heart surgery on ourselves in our bathroom because we have specialists for that who know about that and have done it before and have training in it. So we blindly put our faith into them. And a lot of people blindly put their faith into medicines. It's your body. It's your life. I think you have to be your own advocate. I think you have to, at the least, you have to ask questions and not blindly take it on their word. I'll give you another example of why I say this. My father had pretty bad rheumatoid arthritis, and the doctor prescribed for him a drug called Celebrex. And Celebrex was supposed Celebrex, and it was supposed to be a wonderful drug and help him all this. My father developed a very severe stomach ulcer from it because the doctor forgot to also prescribe for my father a special pill that coats your stomach, because Celebrex was known for creating ulcers. It damn near killed him. So here's what I mean. This was a doctor who, very intelligent man, my family had been going to him for like 40 years, and that, the whole bit, he treated my whole family and everybody, and we trusted him. So we never questioned about the Celebrex until it was too late. So there you go. What are people saying here? Melly, that's the hook that makes you the DNA. Oh, DNA. And Andy says, don't even get started on the client servicing side of the medical profession. Oh yeah, let's talk bedside manners. Let's talk specialists, okay? Now, these are people, if I'm saying we put our blind faith into our general practitioner that we go to, and we usually build a rapport, like this new doctor, it's Walter's doctor. She took me on when my doctor retired, and I like her. She's very thorough. She's nice. She's very businesslike, but at the same time, she has a nice balance between, being friendly and being businesslike, and she's very upfront about things. So I respect that, and I think she's a good doctor. But it doesn't mean that I shouldn't question what she wants to put me on. I want to know. For example, she prescribed one blood pressure pill for me. I keep my blood pressure. I do it every day, and I bring her my chart to show her. For she wanted me to keep records. I'm keeping records. And I don't have severely high blood pressure, okay? But it's over the number. It was slightly over the number. that whoever creates the numbers, my systolic and dystolic were a little high or whatever. She put me on one medication. I had a reaction to it. It made me cough all the time. So when I went back to her, she says, how's that drug working out for you? And I says, well, I said, I know there's a side effects to it, because she did mention this. And I said, yeah, I'm suffering from the side effect. I cough all the time. She says, okay, there's another one I can put you on, but I also want to combine it with, it's a dual drug. It has a water pill in it, and that's supposed to make whatever this drug work even more effectively. Fine. She wrote me a prescription for that. I took it to the pharmacist and got it filled. Meanwhile, she never said to stop taking the other one she gave me. The way she worded it, it sounded like I was getting an additional drug. So I went in to get both of these refilled. The pharmacist questioned it. He said, you're taking both of these? And I said, yeah. Why? I said, that my doctor prescribed them for me. He said, you shouldn't be taking both of them. So he called the doctor. And sure enough, I was supposed to stop taking the first one she gave me and go on the second one. She never wrote that down. Now here's the stupid part of the whole thing. I was on another drug that she did write discontinue on the prescription when she wrote me a new prescription for a different one. She didn't do that this time. And I didn't question her. That's my bad. Okay. I should have said to her, oh, okay, so I'm taking both of these now. I didn't question her because blind faith, right? So then I was on both of them. Well, then the pharmacist called up and says, no, stop the first one. And so I did. Now, I didn't have any reactions. I took it for 5 days, double doses on it. Actually, didn't notice it made any difference either, for that matter, in my blood pressure. But nevertheless, mistakes happen. They don't know everything. So they know more than you do if you're not a doctor. But I guess you got to be your own advocate and ask questions. And that's really what I meant, which I don't think I expressed myself very clearly on my vlog on Monday. And Julie took exception to it. And that's fine. I mean, nothing against Julie about it. Her points were valid with it all. So anyways, what else did we were going to talk about in the system of this?
Well, I think healthcare is a really complicated topic to be talking about in one sort of sitting.
Well,
it's not something that you can get covered by everything.
Well, the other thing too, it's an emotional topic because as we grow older, we're more reliant upon the healthcare system, unfortunately, and we all have opinions, and those opinions all stem from what our past experiences have been. My past experiences with doctors have not been horrible, but have not been stellar either. So I'm always walk in with a certain amount of skepticism.
Yeah, well, I have the same thing. I have had problems before with doctors, and I question a lot of stuff that comes up too.
But you know who the worst doctors are? Not the general practitioners. No. General practitioners are working right at the root level, okay? They're the first line of defense, whatever, for you. Then they elevate it by sending you to a specialist. Now, why did they send you to a specialist? Because they don't know everything. If it's something that requires more knowledge, they send you to the people that work with this all the time. Great, wonderful, that's what they should do. But I have found with specialists that once they get to that level, they forget they're dealing with human beings. They're specialists because they really love the research. That's what they exist for. They're right on top of what the newest things are in their field. And so they immerse themselves in that. And they forget, many of them do, not all of them, but many of them do. And the ones that I've had to deal with through my father and my mother and everything like that, they focus on the disease and forget that that disease is attached to a human being. A human being who's sitting there scared out of their mind because they don't know if they're going to live or die tomorrow, and the specialist is too focused on the disease and not the human being with it. I'll give you an example. My father went to a specialist when He couldn't walk anymore. This guy was an idiot. He was saying, well, you should do this and you should do that. And I'd say to him, we've done this. We have tried this, and that's not working. He was abusive to my father. He was especially abusive to my mother. He was sexist. He wouldn't speak to my mother. He didn't want to have anything to do with her. He didn't even focus on my father. He focused on his computer and his paperwork. I went in with my father a few times, and one time I'd had enough with him, and I let him have it. And I said to him, I want you to know you're not dealing here with stupid people. I said, you have your area of specialization and you have an education in it, but I want you to know that I'm an equivalent professional. I am on the same level as you are intellectually. It's just I'm in a different discipline. I have just as many goddamn university degrees that you have, and I am an expert in my field, just like you are. But if I dealt with my students in my classrooms or with my administration or the parents of my students the way you are dealing with my father right now, I said, I would probably be having to take you, they would probably take me to the Board of Education and the College of Teachers and have a complaint against me, which I'm not against doing with you, with your equivalent. I don't think the man had ever been spoken to like that. Suddenly his attitude changed. Suddenly he started to address us as people. Suddenly he started to look at other things instead of just dismissing it and saying, well, yeah, you got to do that and bye-bye. But it shouldn't have taken me to get on a high horse and do that for him to be that way. I had a kid that I was teaching. Brilliant student. Smartest student I ever had. His name was Abhishek. I will always remember Abhishek. He was in my grade 12 university level English class. He wanted to be a doctor. In fact, he already knew what kind of doctor. He wanted to be a brain surgeon. He wanted to be a neurologist. This kid had absolutely no personality. If you've ever seen the show, The Big Bang Theory, I used to call him Sheldon because he's actually like that character. He was oblivious to the social niceties of the world. He was totally focused on what he was going to be a specialist in. Smart kid. But I thought, oh my God, you're perfect for being a specialist because you have no bedside manner whatsoever. He came back to the school that summer after he graduated and wanted to know if I would write him a letter of recommendation, a reference, so he'd get into medical school. I said, where are you going to medical school? Ireland. I looked at him and said, I know you want to be a brain surgeon. We have excellent medical schools in our own country. Why are you going to Ireland? Because it's extremely competitive to get into the field here in Canada. I know I can get in Ireland, and I can get in and I can get out and get on with my practice. And I said to him, why do you want to be a brain surgeon? And this is the Sheldon part of him. He could have been a little bit more modest. He said, well, I want to help people, and I find this a very fascinating end of science because, we don't know that much about how the brain works, and I really like to pursue that and a whole bit. No, what he told me was this. He said, because I don't have to deal with all the crap that a regular doctor has to put up with, and it makes a lot of money. Okay. Now, that's, let's
You don't know
see.
how far he got, though.
Oh, I'll bet you he went all the way, and I bet you he is a neurologist, and I bet she's a very smart neurologist, and I bet she's an asshole. So, right there.
Julie Chambers, never been my experience.
No, and that's what I
No. I don't know if it's the answer to suit you or not.
No, Julie said water tablets help lower blood pressure, and that's what she told me. The doctor
Yeah, I
did
know
tell me
some
that.
people take them.
Andy says, I always ask the pharmacist about my meds. Found out the hard way that doctors don't always know. In the States, pharmacists have to take ongoing professional development training every 2 to 3 years. Julie says, never been my experience, Stephen. Well, never been your experience. I'm confused, Julie,
Yeah, I
because we
don't
got so
know.
many
Like, I
things
mean,
going on.
I had an accident in 2007 and ended up having to get surgery done. And the doctor I had was a nice enough guy, but he didn't have a great bedside manner either. And I woke up in the hospital. I was dazed. I was confused. Do you realize what happened to you? And I said, yeah, you kind of fixed my leg. And he said, and then he just sort of went on some rant and started yelling at me. And I'm going, well, sorry.
Yelling at you about what?
What did, I don't know. I can't remember. I just remember
Oh.
waking up and he was like, I was kind of dazed and I wasn't sure exactly what happened to me at the time. And then he sort of went on this, well, I fixed your leg, blah, 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 and all this other stuff. And I was drugged up. I didn't know what I was saying. So, like, I mean, and that same doctor, I heard him say there was a lady, well, I could see him get frustrated with stupid people. But the lady, there was an old lady that came in and she had broken her leg or something and he had fixed her. And he said to her, oh, are you in good health? And she goes, oh, yeah, I'm in good health. And then later on he came in and said, how many drugs are you on? And so she listed like about 10 different drugs she was on. And then he started yelling at her. He says, I thought you said you were in good health. You're in awful health because you're taking all these drugs.
You see, I would trust a pharmacist when it comes to drugs over a general practitioner, because pharmacists deal with this every day. They're up on all the latest drugs and the whole bit. And in my drugstore's case, Shoppers Drug Mart, they have a whole, they call it Health Watch. And they are constantly looking at the drugs you've been prescribed, and they're looking at your history of drugs you have, and they know, and they will take you aside and say, okay, have you ever taken this drug before, especially as a new one? And they'll say, okay, you're taking this and this and this. We recommend that you do this, this, or the other thing. They check up on you. And I already mentioned the fact that this pharmacist checked out on that double dosage when I only needed the one. So, you know, I do trust them. In fact, in order to become a pharmacologist, they're damn near a doctor as it is, because pharmacologists are not dumb people, because the amount of chemistry they have to know and everything else, it's mind-boggling. You are not a dumb person if you go into pharmacology. There's just no way you could ever survive through those courses. Andy says, first time I met my doctor, I told him I wasn't comfortable going to doctors because I thought they were all quacks. He laughed and has been cool with me ever since. Well, yeah, you kind of insulted him. And I wouldn't say that to their face unless, yeah, I had to.
Well,
but I mean, I understand how they would feel about a comment like that. I would feel the same way if a parent, and it has happened, where they question my professional ability as a teacher. You know, there's a line, all right? I am not saying that all doctors, everybody in the medical field are out in it for the money and what they can get out of it and don't care about anybody else. No, there are lots of really, really good people in the medical field. I mean, I'll tell you right now, the nurses. The nurses have to be the top of the list in the medical field because they deal, even more so than the general practitioner, they're dealing with the worst of conditions. They're dealing with sick people. Sick people are not happy people. There's no way. And you can criticize them all you want, but God, I wouldn't want to do that job. There's no way. You were going to say something?
no, I can't remember.
Tracy says, always look up the drug online before filling the script. Yeah, you can look at them up. I got a laugh every time I watch an American station and they put commercials on for new drugs. They go, oh, if you're having this problem, you should try Cure All Wonder Drug. It's going to do lots of things for you. Then they start to list. It may have certain side effects, like you may be super susceptible to sunlight. You may have persistent coughing, welts, shingles, breakouts, acne, two-dog-headed syndrome. You may talk in tongues, and you may want to set yourself on fire. Try it today. Ask your doctor about it. Hello, doctor. I was thinking about this drug.
This drug's not suitable for all people.
No. If you're suffering from kidney failure, heart failure, lung failure, brain failure, any kind of failure, this drug may not be right for you. Not good if you're already dead. Oh, okay, thank you. I mean, I have to laugh at those because by law they have to say what the side effects are. Because you know if that wasn't a law, they wouldn't be volunteering that information. So, who do you trust? If you've had a good, like Julie obviously has had good experiences in her life. And that's great. I'm glad that you have, Julie. I haven't had horrible experiences. I've had questionable experiences. I'll say that make me a little wary. But the bottom line is, If my doctor strongly suggests that this is what I'm supposed to do, then I will probably do it.
I mean, one problem with our healthcare system in Canada, because it's so accessible, is that there's a lot of people that end up in emergency rooms that probably shouldn't be in emergency rooms. Like I had an incident where I wrecked my leg. I severed a tendon in my leg, and I was in the emergency to have it looked at. And there was somebody sitting in the cubicle next to me, and it was a mother and a son. And she brought her son into the emergency because he was having a temper tantrum, and she didn't know how to handle that.
Mm.
So that's the problem with our medical system, is that people abuse it. I don't think that somebody should have been taking their kid to an emergency room because he was having a temper tantrum and she couldn't handle it.
Maybe she wanted a shot to sedate herself so she could handle it.
Yeah, I know. Like, I mean, so then what ends up happening is then a lot of the doctors in the emergency rooms don't necessarily take you seriously when you have a problem.
Yeah,
So-
Tracy says some woman was at the ER for sunburn. Well, depends on how severe the sunburn was, because, I mean, you can get, blistering up, but...
And you had a mandolin accident.
Oh, yeah, okay, this is kind of funny, but it's not. A few years ago, Walter bought a mandolin. Now, not the musical instrument, okay? It's the thing that, slices, dices, and makes julienne fries, and that kind of thing. It's got the blade, it's got the chute. Well, we got it because it's the stupidest reasons for getting something. I saw a recipe in a magazine, a cooking magazine that our local liquor store has, the LCBO, the Ontario Liquor Board, put out, and it showed how to make your own potato chips in the microwave. But you needed to cut your potatoes really, really sliver thin, right, with a knife. And I said something, well, it'd be easier if you had one of those things that slices, dices, and makes julienne fries. He goes to Crappy Tire, brings home a Starfleet one, right? And this is great. So I got the potato in. This bugs me when I start to talk about it. And I'm slicing it through, and it's getting down near the end. Well, there is a guard thing you can put on the top, but no. Did I put that on? No. And I should have. And I sliced my thumb. And I sliced it very nicely. It was a deep cut in my thumb. So immediately you get bandages. Well, all over the place. It is not. The bandages are not working. So we go down to...
So no, he's going, I'm not going to, I say, we got to go to emergency or something like that, or a walk-in clinic. And he's going, I'm not going to walk-in clinic, I'm not going.
It's just a flash
he's bleeding through bandages, right? So we go to the walk-in clinic. They have like 3 people looking at him. They try to cauterize it.
Okay. So they decide they're going to cauterize it. I've never had cauterization before. They get out this silver nitrate rod or something, they call it. And they said, okay, this might sting a little bit. They hit the thing with it. I hit the ceiling. Walter could hear me scream out in the waiting room. I had never felt pain like that in my life. And when I came down on the table, then they wanted to do it again. I went, no. And the guy's going, oh, okay, well, let's bandage it up. So they get this huge bandage. It's on my
Looked like
thumb.
a mummy.
A
mummy on his thumb, right?
So I leave. They bound it all up and everything. We're not in the car for more than a minute. And the blood is seeping through. So we go, turn right around, made a U-turn, went right back in the clinic. They look at it again and go, okay, we can't do anything for you here on that. You'll need to go to emergency in the hospital. So I've got this huge thing on my thumb. It's oozing blood and everything. We get into to the nurse's station in emergency. Hi, what can I do for you? And they're busy, and I go, okay, cut my thumb on a mandolin, and I went, the musical instrument? No! The thing that slices, dices, makes julienne fries. And, oh, don't get one of those. Take that back. Never use one of those. They're horrible. And then they had a 5-minute discussion about everybody they've seen that have had mandolin accidents. And I go, meanwhile, I'm dripping. So they get me in. I go in.
They took him in right away.
They took me in right away. And so the guy, the doctor's looking at it and go, okay, we're going to cauterize this. And I said, funny. That's what the other doctor did in the other place. And I said, that hurts a lot. He said, well, then he got out a needle, right? And I said, what's that for? Well, to freeze it. So, he said, he never froze me when he did it. He says, he didn't freeze you? Holy crap, no wonder you were stuck to the ceiling. You think? So they froze my finger and they got it all fixed up, and that's good. But to this day, even as I talk about this story, and that's quite a few years ago now, I can still feel it. My thumb. So, just say no to mandolins, not the musical instrument. Okay? So that was a little side. Well, Julie says she was a nurse for 20 years. Well, that's why Julie knows so much about health. I figured you probably were, Julie. There's that. Tracy says, my mandolin is hard to clean. Tracy, get rid of it. Get rid of it. If I walk down an aisle in a store and I see mandolins, I start to shake. She says, I used my mandolin, sliced banana blossom, and the latex and the blossom stained it up. Even Martha Stewart has cut herself on a mandolin. Well, Tracy, I hope you never cut yourself on your mandolin. Get those gloves that are like, that nothing can cut through when you're using it. I think that would be a good idea. Mel says, listening to all that, I feel lucky that I've been pretty healthy all my life, but who knows what future brings. Yeah, I know.
Yeah, you never know.
Well, anyways, I don't know.
So
we dealt on a lot of things and it went around in a lot of circles, but I guess the bottom line is, yeah, our healthcare system in Canada is pretty good in comparison to a lot of ones in the world, but it could always be better. But I think universal healthcare, meaning everybody gets the same treatment, it's paid for completely, you don't have to mortgage your house for it like they do in the States for surgery or anything like that. I think that's a human rights issue, and I think every human being is entitled to that. And if we have to pay a little bit more in our taxes to cover some of that, then I say I'm all for it. Simple as that. And as far as my trust in the medical society is concerned, I don't distrust them, but I trust them with caution with that. And I do not trust pharmaceutical companies. But we're a society that depends upon pills.
And they have to be there to develop them, so.
Yeah, so, it's a catch-22, I guess. Anyways, on that healthy note, I don't know what we'll talk about next week.
What are you watching?
Oh, what are we watching? Oh, yeah, we're watching... Oh, you want to watch something that's funny, but it's dark humor? It's called The Boys. It's on Netflix.
No, it's not. It's on Amazon Prime.
Oh, that's right. It was on Amazon Prime. Okay. It is... I liked it. But it's very dark. It's gruesome. It's gross. But it's good, I think. And if you want to...
I'm watching it right now.
Oh, you have no appreciation for anything. Anyways, you still think that one that's on Netflix, that The Other or whatever that's called, or The Others, or what's that space thing that...
Yeah, that one wasn't very good.
Yeah, well, you watched it. Did you watch it all the way to the end?
Yeah, the last 3 episodes was better than the rest of it.
And the other show that we've been watching is on FX. I think it's FX, isn't it?
Yeah.
Pose. I think we mentioned it one other week. It's really good. And I think I talked about the ball culture and everything, and it's a good show. Julie says, well, it does burn your flesh. It has silver nitrate.
Cauterization.
Oh, yeah. Yeah, you smell like barbecue. Yeah, we haven't been to a show in a while. And nothing else I can think of. Just as an aside, those of you that follow this, Jody's not on today. You know that one, the guy out west that was fixing up that house that he was trying to sell, and he's the antique guy, Curiosity Inc., Alex? Well, he's now bought his little general store, and he's trying to fix that up, but he hasn't sold the Potter's house yet. He's asking way too much money for where it's located.
I think it's down to 200. He started at almost 300,000. Now it's down to about 205,000 that he's looking for. Tried to auction it off, but nobody would take it.
No one would take it.
So
I think he's got an albatross around his neck.
Well, it is in a small community, 300 kilometers east of Edmonton.
Which means
in nowhere. The community's not that big. It's basically nowhere.
Yeah.
In northern Canada. and
Northwestern Canada.
northwestern Canada, and it is darn cold in the wintertime.
Mm-hmm.
So, like, we're talking
40 below.
minus 40 Celsius, which is minus 40 Celsius is minus 40 Fahrenheit. So,
And that's a warm day.
yeah. So, in the wintertime, so I can't see too many people running out and wanting to buy a house there.
No. But anyways, that's just another aside there. Okay, time for us to go. So I don't know what our topic will be next week.
Mm.
If you've got suggestions for a topic next week, write them in the comments below or send me an email. We'll figure that one out. And I hope you all have a healthy week. Don't take too many drugs. And don't drop dead. And mind your mandolin. And we'll see you all next week. Bye for now. Say goodbye, Walter.
Bye.
I said say goodbye, Walter.
Goodbye, Walter.